It's the Beth Cahill Show. And now, here's Beth.
Good morning, everyone, and welcome back to another week of the Beth Cahill Show. I hope everyone out there is staying safe, all while practicing this new term that we are calling social distancing. I hope that most of you are able to work from home, and the ones that are not, thank you. What an incredibly difficult time to have to go into work. So I and so many others thank you for that. To all the people in the medical field, our first responders, I also thank you. I am so grateful for all of these professions and the service that they are doing for the rest of us during this incredibly difficult time. So I know for my family in particular, it's been hard to get into a rhythm. I think that we have finally, knock on wood, but I do think that we have finally found our stride and things are going much smoother. But for all the moms and dads out there trying to do it all right now and trying to navigate this new life that we have at the moment, you're appreciated and this too shall pass. We are all in this together. So whether it's trying to put schedules together for our little ones, trying to, go to work or stay at home and work and be a teacher at the same time, I think what we have all realized is that teachers should get paid far, far more than they're getting paid. Something I have always known, but I think the rest of, the world right now shares in that sentiment. So again, we will get through this. We are all in it together trying to navigate this. So any tips that anyone wants to share, feel free to email me and I can share them with the rest of us. But for the time being, I hope everyone knows how appreciated they are in the jobs that they are trying to do right now. As far as the coronavirus updates, though, I did want to get into those. So this week, Italy actually surpassed China's death toll. Now, again, that is if we are to believe everything that comes out of the Chinese government with their numbers. So at this moment, yes, we have had Italy has surpassed that death toll, and the United States, our confirmed cases have now surpassed the 10,000 mark, and actually by a significant amount. We are, some upwards of 15,000 at this point in the United States, with roughly, 300 confirmed deaths. So this has now spread to all 50 states. There is no state that has not been touched by this. Although New York, Washington, our home state, and California are still carrying the majority of those cases, New York being hit incredibly hard right now. They are over 7,000 cases. The president is sending a United States Navy hospital ship to support the medical centers that are there because they are in desperate need of some help in New York right now. There is, it's incredibly hard to watch because it's hitting everywhere, of course, as you can see, and it's hitting other places harder than others. So we all send our well wishes to New York at this moment because they seem to be taking the brunt of it in our country at this moment. The president this week also put a level 4 travel advisory, came out from the State Department. They have basically said to all United States citizens that are choosing to travel internationally at this time, you should come home immediately unless you plan to stay outside of the United States for an indefinite period of time. So that state advisory, Travel 4, went into effect Friday at midnight. So that is something to watch for. Again, if you are overseas, I would come home. Otherwise, you could be there for longer than you wanted. That is the message coming out of the State Department. So California's governor, Gavin Newsom, he was the first governor in the country to, kind of go on and take these extreme measures on Thursday night. And he put the state of California, keep in mind, that is roughly 40 million people on a stay-at-home order. So what that means is you don't get to go anywhere unless you have to, right? So you stay home. It's a stay-at-home order. It is what it says it is. Unless you are, part of the essential category list, you'll be shut down for the time being. So that is something to watch. New York has implemented something similar on Friday morning. Governor Cuomo, he did the same thing. So we're probably going to see an increase of this throughout the country. You're going to see this in harder hit areas, governors throughout the country implementing these stay-at-home policies. So, we just need to heed their warnings. And yes, it's an inconvenience. It's nothing that any of us want to do, but it's something that we have to do for the time being to, again, stop the spread of it. Not stop, I shouldn't say stop, to slow the spread of this and help our healthcare system to get caught up and not overwhelm them. So that's where we're at. I do want you to take a listen to Governor Gavin Newsom when he was asked about this week. Take a listen to him here.
Based upon our models, based upon our trend lines, based upon some new information that came in as it relates to those models from Johns Hopkins and among others, we felt it was appropriate to raise the ante and do what we can to bend that curve. Let me remind you, the numbers we put out today assume that we're just along for the ride. We're not. We want to manipulate those numbers down. That's what this order is all about. The projection said we will have, but we don't live by projection. Again, I began this by saying we are not victims of fate or circumstance. The future is something inside of us. It's our decisions that will determine those projections. And that's why we decided today to make this decision.
So here is where we are as far as the treatment or the vaccines are concerned, right? So we have these stay-at-home orders in place. What does that mean, right? How long is it going to look like this? Well, as far as a treatment, we'll talk more about that a little bit later in the show, but there is some hope in regards to that. And as far as the FDA is concerned, President Trump has ordered them to fast track any vaccine, right? So basically, he said, let's cut all the red tape around this. Let's cut around what usually is going to take so long to hit a market. And essentially, he's waived all of that and just said, go for it. Move as fast as you can. So that's, kind of where people are at and what they're working on at this point. So Dr. Deborah Birx, I'm not sure who has seen her. You probably have. She's been in a ton of press conferences, doing interviews on, major news networks, radio. She's been everywhere. And she has been so incredible on all of this. Her and Dr. Fauci, who has now become, a household name, but those two have essentially been the face of this effort, and they have been outstanding. I heard someone actually say the other day that they should receive the Medal of Freedom Award when all of this is over, and I could not agree more. I can't say enough how incredibly, informative both of them have been in the face of this crisis that we are seeing. So hats off to them. If you guys don't know who they are yet, look them up, watch them, get your news from them because they are incredible. Listen to Dr. Birx, though, because this week she was asked, when can we expect this virus to let up? Or, how close are we to a vaccine? And listen to her response here. I think it's important.
I think we're all looking very closely at the data coming out of China, the data coming out of South Korea. We're encouraged by the recent reports from China of no new cases. We're watching very carefully about China going back to work and seeing if that impacts the spread of the virus. So we're learning from other countries. If our profile looks like China, we believe that is very quickly, but we're evaluating every single country and the data coming from that country.
Dr. Birx, I think Americans can handle just about anything, but they do need to know what to expect. You mentioned China as a possible timeline. Right now, we're in this 2 weeks to slow the spread period, but there are other reports coming from the administration about a possible 18-month fight. How long should Americans be prepared to take precautions to fight this pandemic?
That's a great question. The models not only looked at what's happening during this current outbreak, but with respiratory diseases, they have a peak and often fall off during the summer months. If this works like every other respiratory disease that comes to us in the winter, then we're tracking very carefully about what would happen if it came back in the fall or came back in the fall after that. And that's why the president's been working nonstop, both on therapeutics that could be available in the summer and fall, and vaccines that could be available in the fall of 2020. So it's just a today vision, a tomorrow vision, but also a 90-day vision, a fall vision, and a fall 2021 vision to make sure that we're following everything.
At this point, when do you anticipate the peak to be?
Well, the only thing we can look at is the same thing you all are looking at, is what the peaks look like in every other country.
So look, this is not going to go away anytime soon, right? But what we can be hopeful about is how fast things are progressing. They are actually progressing at a rate that we have actually never seen before. The president has been good for this moment, and here's why. To all of his critics, which there's a lot of time for critiquing this president on some of the ways that he, speaks and handles things, but for this moment, he is very good. And again, here is why. He understands the private sector. That's what he did, right? That's how he built his empire. And now during this, incredibly difficult time that we have, He is bringing in the private sector to help fight this battle. It cannot come only from the federal government. It needs to be your local government, the federal government, and now the private sector. Everyone has to pitch in. I mean, it's an incredible thing to watch because we have companies in this country that are stopping manufacturing of their own products. I mean, there are some car companies out there that are doing this, and instead they're going to take up manufacturing of medical masks and ventilators and gloves. I mean, it's incredible. There are cruise ships that are offering up, their ships for extra bedding for sick people. There are construction companies donating their masks to medical professionals. These medical professionals desperately need them. I mean, I'm sure you've seen pictures going viral of people sewing masks. I mean, they need those masks. And this is what is so great about America. In times of crisis, people really do come together. I am so inspired by what I'm seeing in this country. From the truck drivers that, they're working tirelessly and endless amounts of hours to make sure that our stores remain stocked. At the beginning of all of this, you were seeing all these pictures of empty shelves, and now you're seeing pictures of full shelves. You know what? Thank those truck drivers. They're working, again, endless amounts of hours to make sure that there is food delivered to our grocery stores. And the farmers that also work tirelessly year-round to make sure that there is food to deliver to the shelves. Thank your farmers. Thank your grocery workers. Thank your truck drivers. I mean, it hits home for me personally because my dad was a truck driver and my stepdad was a farmer. I know firsthand how society reacts to those type of professions, or treats them. Is there a stigma on them? And for the most part, it's not usually good when they talk about truck drivers or farmers. I mean, it's not the prestige you get when you talk about being in tech or any of those companies. So it's important to remember in times of crisis the companies and the professions and the people that we actually turn to when we need that help. So everyone is doing their part. All of these professions are great, but I do hope that we remember when all of this is over, the truck drivers of the world, the farmers of the world, all of those guys that got us through it. It's also equally important at this time we continue to give blood, and that's something that is being overlooked. And I got to tell you, we are dangerously low on blood right now. You hear it everywhere. The Surgeon General actually had a message, and his message was particularly focused to millennials on this time, but this goes for all of us that can actually do it. So here is his message. Listen to this and we can talk about it when we get back.
Thank you, Mr. President, Mr. Vice President. Today you heard a wonderful announcement from the FDA, and I just want to give a shout out to Steve, Dr. Hahn, and the folks at the FDA where several hundred of my Commission Corps officers work. You're right, Mr. President. They are tireless. They're doing things that have never been done before to bring the most prudent advances to the American people. But I want to talk about something different briefly. We know many of you are home practicing the President's guidelines for social distancing. But one thing we should all consider, especially our millennials and Gen Z, is donating blood. As an anesthesiologist who still practices at Walter Reed taking care of our wounded warriors and our soldiers, I know donated blood is an essential part of caring for patients, and one donation can save up to 3 lives. Blood centers are open now and in need of your donation. I want America to know that blood donation is safe, and blood centers are taking extra precautions at this time based on new CDC recommendations, including spacing beds 6 feet apart, disinfecting surfaces between patients, temperature checking staff, and encouraging donors to make appointments ahead of time so we can space them out. Social distancing does not have to mean social disengagement. So give blood today. You'll feel good about it, and you'll be helping your country and your community during this crisis. And you might even save a life.
So it is safe to give blood, and boy, do we need it right now. Find your local blood center. I encourage everyone listening to this, take the time to go out and give blood. I know that I will be doing that in this time of need. It is something that we can do. It is our duty to do it, and it's a way that you can help in society right now with what we are dealing with. So go give blood. I really encourage you guys to do that. Moving on, though, because I did want to get to the stimulus package and other areas that the federal government is doing to help out Americans financially in this crisis. So The first thing is the president has just extended the tax filing deadline. So that went from April 15th to July 15th. So if you're getting a refund, it doesn't matter. You can still file on time and you can still get that refund. It's more to help out people and businesses that are going to owe taxes. It's giving them some, relief and some time to pay this on time. It's also going to keep that money in the economy right now. So both are equally important to give relief to the people and the companies and to keep that money in our economy right now. So secondly, the proposed payments to taxpayers. You've probably heard a lot about this. It was very important for this president to get money into the pockets of Americans that are not working or that are being affected by this pandemic. So, what should you be receiving? If you are an adult, you will be receiving $1,200 per adult or $2,400 per couple, however you want to look at it. There will also be a $500 check for per child in the home. So these checks are supposed to be issued twice. We are supposed to see one on April 6th and the other one coming on May 18th. So watch for those. The president was in a news conference on Friday when someone asked about this, whether or not it was going to be enough money. He said that they were working on much, much more. So stay tuned for that. At this point, this is what we know: $1,200 per adult and $500 per child per home. So again, April 6th, May 18th, that is when you can expect to receive those. The president has also called for interest payments on student loans to stop for the time being. It's a big, big deal. He has halted the interest payments on student loans to stop. It's something that nobody is reporting, and I happen to be someone who still is paying off student loans, so that is very welcome to me as far as the interest on those loans to stop for this time being. We will see more about when that is expected to pick back up. But for now, that is very welcome to many students across this country and many people still trying to pay back that debt. The president has also said that the Department of Housing and Urban Development, better known as HUD, is temporarily going to suspend all foreclosures and evictions amid this virus. So he said that basically immediate relief for all renters and homeowners is going to last through the end of April. They will look at that again when the time comes and see if that needs to be extended. But for now, all foreclosures and evictions will be temporarily suspended, something that is also going to be very welcome because unemployment is expected to skyrocket. They said yesterday, a report said 1 in 5 families are not working for this, and that number is expected to go up. So we will see unemployment numbers like we haven't seen before in quite some time. The federal government is also going to waive the 10% penalty fee, and that is for anyone that wants to withdraw money out of their 401ks. You're still going to have to pay taxes on it, but you can avoid the 10% penalty fee at this time if you need to take money out of those. So again, these are all very important steps. They're necessary steps. And one thing I will say about this is that I keep hearing that people are not supporting this because it's a government bailout. I want to be clear about something. This is not a bailout. The government in most areas are mandating that businesses either work from home, which a lot cannot, or that they close altogether. So why should the American worker, who by no choice of their own, not get paid when they're being mandated to stay home and not work? It's not their choice to not go to work. Most of these people are wanting to hold on to their jobs. Actually, all of these people, and no one wanted to lose their job over this. No one wanted to stop receiving paychecks. And again, these might not even be enough for a lot of people. So this idea that it's this big government bailout and, it's looked at as socialism. I mean, social media is the worst at this time, but especially for things like this. I just want to say it again, in an unprecedented time like this is relief to the American worker. It's not a bailout. It is relief, not to be confused with welfare. I think that's incredibly important. So I did want to move on to one more positive that we heard about this week regarding possible treatment on the coronavirus. There is a drug out there that has been, in the United States for decades, and it has been used to treat malaria. They are seeing some promising results in the early phases of treating patients suffering with coronavirus with this drug. So I will say I watched the press conference on Friday morning, and the press was asking Dr. Fauci about this. And he was very, very disciplined in his message to say that, this was not a clinical trial. it was used on some patients and they saw positive results, but that in no way should we assume that this is going to be the cure, just that there are some positive signs. So I will add to that that is Dr. Fauci's job. He has said over and over that he wants to be the overreactor because that's his job. His job is to forecast what's happening. He does not want to overpromise a treatment and have it fail. But other doctors have said that there is a lot of hope to be had in the response that they are seeing from this drug. Let me give you just a few numbers on this. So what we know is that there was a pilot done in France, and there was a dramatic reduction in the amount of viruses that had been treated 3 days after they started the medicine. And within 6 days, 100% of the people that were treated with this medicine did not have the virus anymore. So for anyone out there looking for signs of hope, this may be something to cling to for now. I mean, those are incredible numbers. Even if it can just stop the contagiousness of this drug, because as we know, it is way more contagious than the flu. So that kind of changes the whole broad scale of numbers altogether if that turns out to be something that we can depend on here as well. So Dr. Fauci was asked what we can learn from the people that have already been infected. This is questions that, I watch these question and answer sessions a lot. And what people are asking is there stuff that we can learn, from the people that have already been infected? And here is his response. I think it's a great one. Listen to Dr. Fauci here.
Let's take another video from one of my favorite cities, Mary in Oshkosh, Wisconsin. Let's take a look at this.
Since we now have people who have recovered from the coronavirus, is it possible to develop some sort of treatment using the antibodies that they developed as a response to the disease? Didn't they do something along those lines with Ebola?
Right. Good question, Oshkosh, Wisconsin. Very good question. As a matter of fact, that's exactly what we're doing. We're gearing up for a study of both convalescent serum, which is a big word to say taking the serum from someone who's completely recovered, getting it in a way that you can reinfuse it in somebody else, or getting out the proteins, the gamma globulin, the antibodies from that serum and use it as a way of both treatment and possibly prophylaxis, but mostly treatment. Very good question. It's one of our top priorities.
So again, there are some amazing things going on right now in the fight against this, and we have the best people in the world working on it. Rest assured that is happening. I also think, just as a side note, that the country's coming together in a way that we have not seen in a long time, and it's very, very unfortunate that it would take, a situation like this to have that happen. But I do think that we are seeing the American spirit at its best, right? People and companies helping out in ways that they can. So in these uncertain times, it always helps me to look for the good stories, right? You're going to see the negative ones everywhere. They are everywhere, but so are the good ones. Focus on those stories because they are infectious. They will make you want to do good. I mean, we are seeing now politicians and media come together in a way that I think America has been yearning for. Of course, not all of them. Not all of the media. Of course, we can't ask for that. Not all of the leaders, but, leaders that haven't seen eye to eye in a very long time. And I think seeing how they're working together to fight this is such a good and welcome thing. A leader that I will tell you has been incredible through all of this, and I watch his pressers every day, is the governor of New York State, Cuomo. He has been so good. He has proven to be the calm in the storm for New Yorkers, and he's proving to handle this crisis in a way that we always hope our leaders will in crisis situations. I mean, even Dana Bash from CNN, in a rare case, she gave praise to our president. Listen here.
I mean, look, this is just coming back to where this conversation started after the press conference. I hear what Sanjay is saying about Tony Fauci giving, a little bit more wiggle room than others. But if you look at the big picture, this was remarkable from the President of the United States. This is a nonpartisan. This is an important thing to note and to applaud from an American standpoint, from a human standpoint. He is being the kind of leader that people need, at least in tone today and yesterday, in tone that people need and want and yearn for in times of crisis and uncertainty.
So people from all sides of the political spectrum are coming together to fight a common enemy. And we thought that it couldn't be done, but we are seeing it now. And it is very, very welcome for most Americans. There was an ABC poll that came out this week, and they asked if people approved of the president's handling on the coronavirus, and 55% of Americans said yes, they did approve of it. 43% saying they disapproved. Those numbers were reversed last week. So I think it's important for this president to continue with the tone that he has had in leading this country in this time of need. And I think it's important for all of us to try to rally behind our leaders, whoever they may be, and help them, because they need all the help they can get right now. So that is it for me today. Thank you again for tuning in to the Beth Cahill Show. I will be back same time next week. All of you stay safe out there and have a good week.
This has been the Beth Cahill Show. If you have any feedback for Beth or would like to suggest a future topic or guest for the show, email beth@thebethcahillshow.com. That's Beth at the Beth Cahill, spelled Cahill, show.com. Tune in again next Saturday morning at 9 for more of the Beth Cahill Show, right here on AM 1590. The Answer.